Chris and Kathleen, welcome to Inside South Florida. Tell us, what are some concussion signs and symptoms everyone should recognize?
What people need to know is that concussions can happen anywhere to anyone at any time. And everyone thinks that sports-related concussions are the most common, but actually falls account for nearly half of the concussions that we see in our emergency room, followed by car accidents, physical assaults, bicycle accidents, and now more recently, electric scooters where people are riding around without helmets. And that's actually what we see more often than the actual athletes themselves, is people tripping over the rug on the way to the kitchen, people in the parking lot tailgating before a football game. And that's what's really important to remember, is it can happen to anyone. And the symptoms can be quite vague. Most people have symptoms right away, but some don't. Some have symptoms in a delayed manner. And that could vary anywhere from headache to dizziness, trouble concentrating, confusion, memory issues, insomnia, sometimes depression. And for many people, they'll get better on their own without any significant management. But for a lot of people, they don't get better and the symptoms can be quite prolonged. Up to 17% of patients actually may continue having symptoms and will be unemployed a year after their concussion. So it's very important to get checked out, to go to the hospital, to see your doctor, go to the emergency room in many cases, to be evaluated to determine if you've had a concussion and if you need follow-up.
Do you have some simple tips to help prevent falls, especially as you get older?
Yes, falls are actually the leading cause of injury among people 65 years of age and older. And about 1 in 4 of older adults will have a fall every year. And about 20% of those falls lead to some type of injury. Many of those injuries are very serious and life-threatening, including concussions, but it could also be things like hip fractures, broken bones. And older adults, often it takes them much longer to recover from an injury that they've sustained from a fall. Many end up in the hospital, nursing homes. Some never leave the nursing home, unfortunately. And we're particularly concerned about people 75 years of age and older because they have the highest rates of hospitalization and deaths associated with falls with a concussion. So falls are serious, but they're not a normal part of aging. And there are simple, actionable steps that we all can take to prevent falls.
Why should you never just walk off a hit to the head or even a fall?
If people suspect a concussion, they should seek help immediately. As Kathleen mentioned, older populations oftentimes are on blood thinners and they're very high risk for bleeding around the brain or bleeding within the brain. So it's very important for those people to get a CAT scan immediately because it can lead to serious complications. The reality, though, is that most of the people we see with a head injury in our emergency room end up having a normal CAT scan. 90% of the time it's normal, but in the 10% of the time it may not be and it requires further intervention. We actually have a lot of technologies now, so when you come to the hospital, you'll get a neurologic exam. The doctor will take a good history, find out what happened during the fall. And there's other technologies out there that help us to assess whether the brain's been injured or not. Abbott actually has a blood test available now in many ERs where you can actually measure these proteins in the brain that shouldn't be there in the bloodstream, and when they are elevated, more particularly if they're not elevated, they can tell us that we really don't need a CAT scan, but people need close follow-up. And that follow-up might include therapies and things that they should know to avoid to help prolong their or to help to get closer toward recovery. They may or may not need MRI imaging or other technologies that are available, but it's very important to remember to look for those red flags. And those would be serious falls where there's a loss of consciousness or vomiting or severe headache, or change in mental status, seizures, and so forth. Those people need to go to the hospital right away. So my adage is always, when in doubt, check it out and go to the hospital and be evaluated.
What are some resources and steps to take if you or someone you love have taken a fall or suspect you might have a concussion?
I recommend visiting concussionawarenessnow.org to learn more about concussions and how to prevent concussions and falls. In addition, please visit the National Council on Aging's website at ncoa.org/falls to learn about simple, actionable steps you can take to prevent a fall, including the Falls Free Checkup, which is a 13-question survey that you can learn about your own personal risk for falls and steps you can take to reduce that risk.
Thanks so much for hopping on to Inside South Florida and providing this great information.
Thank you.
Thank you.